What if the medications you trust every day could actually be draining your mind, body, and independence without you even realizing it?
Have you ever wondered if the medications you or your loved ones take every day could be quietly affecting your memory, energy, or balance? What if something you trust to keep you healthy is actually creating hidden risks you don't yet see? It's not about fear, it's about awareness. Many older adults assume that because a drug is prescribed or available over the counter, it must be safe. But as our bodies change with age, even common medications can have unexpected effects. Imagine waking up each morning feeling drained, foggy, or off balance, and not knowing why. You might blame age, stress, or sleepless nights, but the real culprit could be hiding in plain sight, tucked into a medicine cabinet. Studies show that millions of adults over 65 experience preventable hospital visits every year because of adverse reactions from medications that seem harmless at first glance. And yet, most of these risks go unnoticed until something serious happens. That's why asking the right questions, paying attention to small changes, and understanding alternatives is so important. And what if I told you that some of the drugs you reach for every day, thinking they help, might actually make memory lapses, dizziness, or fatigue more likely? Wouldn't you want to know which ones, and what safer options exist? The truth is, aging transforms the way medications work in your body. Livers and kidneys process drugs more slowly. Brain chemistry shifts. What was once a simple, safe dose can linger longer than expected, creating cumulative effects that your body struggles to handle. And here's a fact many seniors don't realize. Side effects can show up gradually. One day you notice a little forgetfulness, the next day more fatigue, and eventually you may start limiting the things you love to do because you don't feel as steady or as alert. It's a subtle decline that can shake confidence and motivation without any obvious cause. Before we dive into the 5 medications every older adult should rethink, let's pause for a moment. Think about this. How many pills are you taking daily? And how many of them have been explained to you in full, including all possible side effects? If you aren't sure, that's exactly why this video matters. We're going to walk through the medications that have been quietly linked to memory problems, falls, or reduced vitality in seniors, and more importantly, what alternatives you can explore with your doctor. By the end of this video, you'll have practical knowledge that empowers you to ask the right questions, advocate for your health, and feel more in control. It's not about stopping medications abruptly or creating fear. It's about understanding how to protect your brain, body, and energy as you age. Every tip here is designed to help you or your loved ones feel safer, stronger, and more confident, starting today. So, let's get started. The first medication on our list might surprise you, and the effects it can have are more serious than most people realize. Stay with me, because knowing this one fact could change the way you approach daily health forever. Let's start with something almost every senior has encountered: sleep aids. Many adults over 65 reach for over-the-counter medications to help them sleep, like Benadryl, Tylenol PM, or ZZ-Quil, often without thinking twice. It seems harmless, a quick solution for restless nights. But what if I told you that this seemingly innocent habit could quietly affect memory, focus, and even your long-term brain health? Yes, something that helps you sleep tonight might make tomorrow a little foggier than it needs to be. Diphenhydramine, the active ingredient in many sleep aids, belongs to a class of drugs called anticholinergics. In simple terms, these medications block a natural chemical in the brain that's essential for memory, learning, and attention. While it may help you nod off faster, the brain pays a price. Studies tracking thousands of adults over 65 show that long-term use, just a few years, can increase the risk of cognitive decline and memory issues significantly. And the scary part? Many older adults take it daily without even realizing how potent it is or that it lurks in multiple products: allergy tablets, combination cold remedies, and nighttime pain relievers. Aging changes how our bodies handle medications. Livers and kidneys slow down, meaning a dose that wears off in hours for someone younger can linger much longer in older adults. The result? Continuous interference with the brain's chemical signals, adding up day after day. The effect is subtle at first, perhaps a bit more forgetfulness or grogginess in the morning, but over time it can affect daily life. Waking up sluggish, needing extra coffee just to feel alert, or relying on naps to get through the afternoon may all be signs that your sleep aid is doing more than just helping you rest. But there's good news. You don't have to give up restful sleep or risk cognitive decline. Newer antihistamines like cetirizine, Zyrtec, or loratadine, Claritin, can handle allergy symptoms without crossing into the brain, and cognitive behavioral therapy for insomnia has been proven to improve sleep naturally without side effects. Even low-dose melatonin, taken at the right time, can help regulate your sleep cycle safely. The key is understanding why your sleep is disrupted instead of relying on sedatives that affect your brain over time. Imagine waking up feeling genuinely refreshed, stepping out of bed with clarity, ready to enjoy your day without relying on medication to push you through. That's possible when you replace old habits with safer, smarter approaches. It's not just about sleep, it's about protecting your memory, your independence, and your energy. Before we move to the next medication on the list, take a moment and think, could your nightly sleep aid be doing more harm than good? Awareness is the first step. Asking questions, exploring alternatives, and talking to your healthcare provider about safer options can help you take control of both your sleep and your brain health. Stay tuned, because the next medication we cover might be in your medicine cabinet right now, and its hidden risks are something every senior should know. Have you ever thought that a simple pill for heartburn could be quietly affecting your bones, memory, and overall health? It sounds surprising, but for many seniors, long-term use of acid-reducing medications, commonly called proton pump inhibitors or PPIs, can do more harm than good. Drugs like Nexium, Pyler, or Prevacid are often prescribed to manage heartburn, acid reflux, or stomach ulcers, and they work extremely well at reducing stomach acid. But here's the hidden catch. Stomach acid isn't just uncomfortable, it's essential for breaking down food, absorbing nutrients, and protecting your body from harmful bacteria. When stomach acid is suppressed for months or years, your body misses out on critical benefits. Calcium absorption drops, leaving bones weaker, which can increase the risk of fractures, a serious concern for anyone over 65. Studies show that regular PPI use in older adults can increase the risk of hip fractures by over 30%. That's not a small number. For seniors, even one fall can dramatically change independence, mobility, and confidence. And there's more. These medications can also increase vulnerability to infections, such as Clostridium difficile, a dangerous intestinal infection. You might be thinking, I need relief. How else can I manage my acid reflux? The solution isn't necessarily stopping PPIs immediately, but understanding alternatives and lifestyle strategies that reduce reliance on these medications. Small changes can have a big impact. Eating smaller meals, avoiding late-night snacks, staying upright for a few hours after eating, and identifying trigger foods like coffee, alcohol, chocolate, or spicy dishes. Even raising the head of the bed slightly can help keep acid where it belongs while sleeping. For those who truly need medication, using the lowest effective dose for the shortest possible time is key. This isn't about fear, it's about balance. By combining lifestyle adjustments with thoughtful medical guidance, seniors can protect their stomachs and their bodies without compromising long-term health. Here's a reality check. PPIs might relieve immediate discomfort, but they could be silently contributing to memory issues, bone fragility, and higher infection risk. Awareness is crucial. It's about asking the right questions and exploring safer paths. Imagine being able to enjoy meals without constant heartburn, while also keeping your bones strong and your brain sharp. That's the power of informed choices. Before we move to the next medication, pause and ask yourself, could this simple, common pill be causing more problems than you realize? Being proactive and discussing options with a healthcare professional can protect both your comfort today and your health for years to come. The next medication on our list is even more widely prescribed, and its hidden dangers are something every senior should be aware of. Stay with me because this could change the way you view anxiety and sleep medications forever. Have you ever considered that the medications meant to calm anxiety or help with sleep could be quietly taking away your independence? Benzodiazepines, known by names like Xanax, Valium, Ativan, or clonazepam, have been prescribed for decades to reduce stress, anxiety, or sleep problems. They work quickly, and at first, it feels like a relief. But for seniors, These drugs carry hidden risks that are often overlooked, and the consequences can be serious. Benzodiazepines enhance the effect of a calming neurotransmitter in the brain, producing relaxation and sedation. That may sound helpful, but it also impairs balance, coordination, and alertness. Older adults are particularly vulnerable. What might feel like mild drowsiness in younger adults can quickly become dangerous in someone over 65. Falls are a major concern. Studies show benzodiazepine users are far more likely to experience falls, which can lead to broken hips, hospitalizations, and loss of independence. For seniors, one serious fall can change life in an instant. But the risk doesn't stop at falls. Long-term use has been linked to memory issues and cognitive decline. In fact, research following thousands of adults over many years found that regular benzodiazepine use can increase the risk of dementia. Imagine taking a medication to calm your mind, only to find it gradually affecting your memory and alertness. Many seniors rely on these medications daily for years, unaware of the long-term consequences. Dependence is another hidden challenge. Benzodiazepines were designed for short-term use, typically 2 to 4 weeks. Yet, many older adults continue them for months or years. Stopping suddenly can trigger dangerous withdrawal symptoms, including anxiety, sleep disturbances, and even seizures. The brain adjusts to the drug, making it difficult to function naturally without it. This creates a cycle. The medication that was meant to help now keeps you dependent and at risk. So, what's the path forward? The first step is awareness. Don't stop suddenly, but speak to your doctor about gradually tapering the dose. Even a slow reduction of 10% every 1 or 2 weeks can allow your brain to adjust safely. At the same time, non-drug approaches can provide real relief. Cognitive behavioral therapy for anxiety, regular physical activity, mindfulness exercises, and structured daily routines can reduce stress naturally and improve sleep quality without the side effects of medication. Imagine regaining your alertness, steadiness, and memory while still managing anxiety or sleep issues. It's possible, but it starts with knowledge and careful action. Benzodiazepines are not inherently bad, but in older adults, the risks often outweigh the benefits, especially when safer alternatives exist. Before we move on to our next medication, consider this. Could your daily pill be affecting your balance, memory, or independence more than you realize? Awareness and proactive steps can prevent serious problems before they happen. Pain is a part of life, especially as we age, and for many seniors, opioids seem like the obvious answer. Medications like oxycodone, hydrocodone, morphine, Percocet, or fentanyl promise relief from chronic pain. But what if that relief comes with hidden risks that could change your life? Opioids are incredibly powerful, but in older adults, they can affect more than just pain. They can impair balance, memory, digestion, and overall health. Seniors receive more opioid prescriptions than any other age group, and studies show that even short-term use increases the risk of falls and serious accidents. Within the first 2 weeks of starting therapy, the risk of falling can quadruple. Imagine stepping out for a simple walk and feeling dizzy or off balance because your medication slows your reaction times. For seniors, a single fall can mean broken bones, hospitalization, or loss of independence. Beyond physical risks, opioids can affect the brain. Chronic use can lead to memory lapses, reduced attention, and confusion. These cognitive effects aren't always obvious at first, and many families mistakenly attribute them to normal aging. But research shows that older adults taking opioids perform worse on memory and attention tests compared to those who don't. The frightening reality is that some of these effects may not fully reverse even after stopping the medication. Dependence is another major concern. Opioids alter the brain's pain response, making the body reliant on the medication over time. This means the drug that was prescribed to relieve pain can actually make pain worse, a condition known as opioid-induced hyperalgesia. Seniors may also experience constipation, nausea, drowsiness, and an increased risk of falls. These side effects pile up, quietly reducing energy, mobility, and quality of life. So, what's the solution? First, not all pain requires opioids. Physical therapy, gentle exercise, and strengthening routines can reduce discomfort naturally while improving mobility. Cognitive behavioral therapy can help retrain the brain's perception of pain, lowering intensity and improving coping skills. Acupuncture, topical treatments, and certain low-dose antidepressants are other alternatives that can safely manage chronic pain without the same risks. If you are currently on opioids, it's crucial to work with a healthcare provider to develop a safe tapering plan while integrating these alternative approaches. Abruptly stopping is dangerous, but gradual reduction combined with non-drug therapies can help restore independence, alertness, and confidence in daily activities. Imagine regaining control over your body without sacrificing mobility, memory, or safety. That's the power of knowledge and careful planning. Pain relief doesn't have to come at the cost of your health or independence, especially when safer, effective alternatives exist. Before we move to our final medication, ask yourself, could your current pain medications be silently affecting your memory, balance, or overall vitality? Awareness is the first step toward protecting your health. Thank you for waiting. Now we've reached the most important and, perhaps, the most surprising medication on our list for seniors. Imagine taking a pill to manage a common issue, overactive bladder, only to find that it might be quietly affecting your brain. This is the reality for millions of older adults taking strong anticholinergic medications like oxybutynin, ditropan, toltrodine, Detrol, and solifenacin, Vesicare. While these drugs help control urgency, frequency, and incontinence, they also carry serious cognitive risks that are often overlooked. Here's the problem. Anticholinergic drugs work by blocking a chemical messenger in the brain called acetylcholine. Acetylcholine is critical for memory, learning, and attention. When you block it, even partially, cognitive function can suffer. Research shows that older adults taking strong anticholinergics have a 50% higher risk of developing dementia over time. That risk increases with each year of use. Imagine unknowingly trading control over your bladder for the gradual decline of your memory and mental sharpness. The effects can sneak up quietly. Seniors might start experiencing confusion, forgetfulness, or difficulty focusing. Family members might attribute these changes to just getting older, but the connection to medication often goes unnoticed. Even within just a few weeks of starting anticholinergic bladder drugs, measurable cognitive changes can occur. That's how quickly these medications can impact the brain. But there's hope. The first step is awareness. You or your loved one should never stop medication abruptly, but it's vital to discuss alternatives with a healthcare provider. Behavioral strategies often work better than you might think. Bladder training, gradually increasing the time between bathroom visits, can help the bladder hold urine more comfortably. Pelvic floor exercises, commonly known as Kegels, strengthen muscles controlling urination and can reduce incontinence episodes by up to 60% when practiced consistently. Limiting fluid intake in the evening and avoiding bladder irritants like caffeine, alcohol, and artificial sweeteners can also make a significant difference. If medication is necessary, newer options such as mirabegron, Myrbetriq, and Vibrance, GEMS, provide relief without blocking acetylcholine. These drugs work through entirely different mechanisms and carry a much lower risk of cognitive side effects. Discussing these options with a doctor ensures that bladder control doesn't come at the expense of your mental health. This medication highlights a broader lesson for seniors. Age changes the way our bodies handle drugs. Kidneys and liver function decline, metabolism slows, and the blood-brain barrier becomes more permeable. Medications that are safe for younger adults can become risky over 65. That's why staying informed, asking questions, and exploring safer alternatives isn't just a precaution, it's essential for protecting both your mind and body. Imagine regaining control over your bladder without losing clarity, memory, or independence. That's not a distant dream. It's possible with knowledge, careful planning, and the right support. Seniors deserve to make informed decisions, weighing benefits against risks, and choosing options that preserve quality of life. As we wrap up this series, remember, the medications we've discussed today, sleep aids, PPIs, benzodiazepines, opioids, and anticholinergic bladder drugs, have legitimate uses. But older adults face unique vulnerabilities. Awareness, proactive discussion with healthcare providers, Lifestyle adjustments and safer alternatives can prevent serious consequences, protect cognitive health, and improve overall well-being. Thank you for waiting and for staying engaged through this critical information. Share this video with anyone who has a loved one over 65. Knowledge is power, and protecting seniors' health starts with being informed. Always consult a healthcare professional before making any medication changes. Your vigilance today can protect vitality, independence, and the quality of life for years to come.